I'm Anthony Wagstaff, class of 1985, RCSI, and I have with me here Kate Coleman, who's my classmate from that time. So we're going to have a little chat and about our time at RCSI and what's happened after. So that's just a short introduction. So Kate, it's nice.
We are censoring certain bits, okay? Because we'd a fabulous class.
The Irish were really young, but you matured. I'm not talking about you specifically, but everybody matured, along the way. So I think at the end of the study of the time that we were sort of, but yes, we did, that was an observation I also made. But it was the same for me, coming from Norway, having this opportunity to get to know and become friends with people from all over the world.
Well, it was extraordinary because we just learned so much. It was like armchair travel. And a few of us were chatting this week and we just said, aren't we just so happy that we didn't accept places in Trinity College or other colleges, which are very good, because our careers over it's our 40th reunion. I'm actually 21, but it's our 40th reunion. And our careers, so many of our careers are totally influenced by our multinational experience in the Royal College of Surgeons. We would never have had that anywhere else in the world.
Yeah, that's absolutely true. And I must say, I mean, we weren't all that much together during the college time. We knew each other, but we're not. I mean, so there's a lot of stuff that I don't know about you that I also picked up underway from a Norwegian ophthalmologist I know. And she said in some conversation, she said, "Oh, Kate Coleman says that blah, blah, blah." I said, "Kate Coleman? Who's that?" I said, what Kate Coleman? "Oh, the ophthalmologist." I said, "Oh, I know her. She was in my class." "Oh, you know Kate Coleman?" So that's, then I got on to some that you've been doing some international work. This very
Well, I was very
interesting.
honoured to be invited to Oslo as the guest speaker of the Norwegian Ophthalmic Society years ago and to present and all of that.
Yes.
And but what was really interesting in college was when we went into our canteen then, there was I think we had 170 Norwegians in college, and there was a whole corner where the Norwegian Dagsblad newspaper came every day, and it really was a mind-opening experience, and that was Norway. So when I went on with my career, my vocation, which is stopping needless sight loss, I tapped into my different friends from my class around the world. And everything we did was, particularly our African classmates, who some couldn't be here this week, why aren't they choosing that job and what's going on in their lives? So everything, a lot of our choices are influenced by our classmates and the different experiences.
Yes.
But it's interesting, Anthony, because you and I had dinner the other night by coincidence, and I did a degree in physiology after I left college. As a woman in those days, I was advised by an incredible professor of surgery, David Boucher Hayes, and he said, here's the bad news. If you want to be a consultant, you're up against the men. So you need to get a few extra degrees, Kate. That's just the way it is. So he made myself and the other classmates, Camilla, etc., he just got us all to go off and do extra degrees, the girls. And we're in Brennan, Lord Rester and everything. And so I did mine in electrophysiology of the eye. And in doing that, I had to do a whole project on altitude and physiology at altitude. And I subsequently trained as an ocular oncologist, and I used that information down the road. I found out the other day that you were one of the world experts in altitude medicine. And this is astonishing. So, Professor Anthony Wagstaff, tell us, how did you get into altitude?
Well, it's I've always been interested in aviation and flying, and I was when I was a child, I was thinking about airplanes a lot of the time. So I've always been interested in that, and I've never been one for reading textbooks so much. So when in college in RCSI, the only chapter I remember jumping into in Guyton was the one about aviation medicine, and altitude.
Yes.
Because aviation medicine isn't only altitude; it has to do with health and safety, how to keep people alive and functional in extreme environments, which I found very interesting. Of course, it's not so much to do with pathology, but it has to do with physiology. So there we meet in a way.
Yes.
That the normal function. How do you make systems to support the normal function of the human, even if the human is subject to extreme environments?
Amazing.
And that's what I find. It's lots of fun. It's very international. I don't know of any of our classmates who are doing the same. It's very niche.
But
So,
could I put this in context?
yes.
What we were discussing the other night was what happened to the body when one was an astronaut.
Yes, that's right.
And
yeah.
you were sharing something with me that as an ophthalmologist, I was going, that's extraordinary.
Yes.
And so before we even get into that, would you accept an offer to go to space for 1 week? And would you accept an offer to go to space for 6 months?
The answer is no and no.
Yes. Share with us the negative side of it.
Well, I'm not. A lot of people think that aviation medicine is like really out there. No, we're supporting the people who are out there.
But what are the
For me-
negative aspects to your body that you would say, absolutely no way is that worth a risk to me and my
Yes.
body?
Well, rockets are dangerous. I mean, aeroplanes, and when you go flying, you feel safe nowadays, right? Because we've got an accident, accident rate, death, where people die, of about 1 in 10 million flight hours
Amazing.
in big aircraft.
Okay.
So we're talking about 1 in a million kind of thing. Rockets are 1 in 100 or 1 in 50. So if you're gonna go to space,
Right.
you're taking about 1% chance
Yeah.
just on the launch pad.
So if you're a tech billionaire and you'd like an ex-wife,
Yeah.
send the other one up to the rocket space for
There
a
you
little
go.
bit.
Yeah, but I mean, we've
Yeah.
all seen Elon Musk's rockets. Some of them go really well, and some of them fail. And they fail often because that's
Yeah.
how they learn. But of course, that's really something. It's a completely different safety case.
But what about when one is in the plane, the physiology of what is happening in one's brain matter, how it affects the body? This is astonishing what you were sharing with me, the different things.
Yes. Well, I think I mentioned to you this space-associated neuroocular syndrome, which is kind of it has to do with fluid shift, basically, but also some other things that we don't really understand fully, but it has to do with fluid shift in the body. When you're in space, you're not subject to gravity. The body fluid shifts upwards. You get puffed in your face. You don't have any. We were talking just now earlier about osteoporosis. You don't get any stimulus to the bones, the muscles, and so on. So you lose a lot very quickly. And
What about your IQ? Do you lose your IQ because of the fluid shift across the brain? You mentioned to me you get irreversible sight loss.
yeah, well,
In some cases.
it's been discussed. It might be irreversible.
Okay.
We don't know enough about it yet, but there are sight losses. There are changes in the eye, and the eyes, the size of the eye and the shape of the eye changes.
Right.
You get. I mean, I'm not an ophthalmologist, but you get edema around the optic nerve. You get lots of changes going on there that worries. One of the things that worries us when we're going to space. I'm not a very. I haven't worked all that much with space medicine. I've been more involved in military
Safety.
aviation medicine, so fighter pilots and.
Well, could I ask you, if you don't mind, because other people might find this fascinating, as an average traveller who might like to choose to visit a pal in the States, you yourself, knowing what you know about radiation exposure, and we have a former college mate, Professor Kieran Murphy, who's a world expert on radiation damage to the body. Do you feel there's a limit of radiation one should be sustaining travelling by holidays over the poles? For example, travelling Dublin to New York and over the pole, somebody told me it's the equivalent of a chest x-ray in radiation. I don't know how many milligray, but as an expert in this field, do you think that's all hype?
Yeah, I mean, they've done some studies on that, and it doesn't seem to increase the risk of anything. We know that pilots get melanomas a little bit more often than the rest of us. They get brain tumors a little bit more often. Maybe that's the data there are a little bit not completely certain, but there's a tendency. But definitely melanomas. So there's a discussion. What's that due to? Is it due to radiation? Is it due to sunlight because pilots are more in the sun, obviously because they travel more, or is it due to UV light through the But I mean, radiation from the upper atmosphere is important for flights going very high, but you've got to fly a lot for that to really mean a difference compared to a lot
Okay.
of other health risks. So I wouldn't be worried too much.
Extraordinary. And you're an expert in aviation medicine. So would that involve advising other military forces or just Norway?
Well, yeah. I mean, it's a niche it's a niche subject. So there are very few of us in each country. So we have a very large sort of community around the world together. So maybe 5,000 doctors, something like that, in the world are doing this. Maybe less. I don't know, something like that. But it's a few compared to all other subjects, really. So that we collaborate a lot. We collaborate within NATO and the aeromedical side, but also civilian, because flying it crosses borders all the time. So we can't have our own rules here, our own rules there. We have to work together to find our common rules, our common ways of looking at safety, and our common ways
Well,
of
what I found
safety.
really exciting about our coincidental chat the other evening was that with the paucity of experts in the field, 5,000, it explains the lack of cross-fertilization of expertise in the world.
I mean, one of the things that really fascinate me is how we, as doctors, but I think it's the same in all professions, we specialize and specialize and keep going to our own little rabbit hole, and we don't sort of widen our perspective and talk to other professions, other specialities, and so on, and discuss stuff like this. So I think that's one thing that fascinates me also is the opportunities of just sort of going out there outside your normal sort of area of expertise and pushing the borders to try and understand more and asking other people and discussing with other people.
How is it for you going back to Norway, having been Irishized here with all our pubs and all of that?
Well, I really enjoyed. I'm half English, half Norwegian. I grew up in Norway, so
Hence Anthony.
I'm mostly yes, hence Anthony. So I feel Norwegian, but at the same time I'm English a little bit, and I felt the international feeling of Ireland and the RCSI specifically gave me a lot of good things regarding how I look upon the world and my field, and so I think it gave me much more than had I studied in Norway. It's the reason I came here was I didn't get into the University of Oslo, so now I'm a professor at the university that I didn't get into, which is kind of funny. But
well, that brings up a very interesting conversation I've had with lots of college mates, because in college it was unique. We would all socialize with all the other years equally, because we weren't at that time a university. College is now a fabulous university with other faculties. And so, we discussed how we had, I think we had this Norwegian Per Magnus, who was a concert pianist. We had these incredibly multi-talented people. He just remembered every single word ever spoken. He never wrote down anything. He was a medalist, and he's gone on to do great things. But there could have been a shift in academic results. I think that's very interesting. The college helps that with the mix.
Oh, absolutely, yes. And I also enjoyed the fact that we could do musical things and doing review. I was involved in that. That was lots of fun. I really enjoyed that.
I did Professor Anne Legg, the late Professor Anne Legg. I had to play her. I had to do her voice. She was absolutely wonderful. But we were only in pre-med, so I won't. We were in medical school, so I won't tell you what my lines were. She was our anatomy lecturer. She was wonderful.
It was great fun. Yeah, but that one advice I got from actually my school band conductor. I was in the school band for a long time, and I remember he said that in your life you should always remember to do, if you're doing work and it's intellectual or doing, always have something that brings out emotions, culture, music, whatever, that where you can actually use other sides of yourself, which is not just the sort of intellectual, analytical part, but also the more cultural, the more using your own emotions and feelings, And that I think that's a balance that I found helps me a lot in my work as well. So
But
what do you use as a? I mean, you work a lot, right? But what do
depends
you?
what you call work.
Yeah. I mean, you
Because
enjoy
at the
your work.
moment, I don't think I work,
Yeah.
but I'm working. What I'm doing in my day job now, actually, I'm an eye surgeon. I used to do all the cataracts and everything. And that eyelid and pattern has to look fabulous,
Oh yes.
or it doesn't work properly. The muscle movement, everything has to blink properly, everything. So the challenge to recreate something that looks fabulous, to restore, say if I remove a whole eyelid, or a lot of my work is restoring sight. I'll interrupt myself. Quite a few of my patients have a condition we now call dermatochalasis. So they've a lot of heavy, heavy lids coming down over their eyes. And people are guilty about trying to help that. But I would take somebody off the road once a month. I would say, you are not qualified. You have no visual field laterally. I'll get you into surgery as soon as possible. Now, the side effect is that I have to make them look like they used to look. So yeah, they look 20 years younger. I can't help that. But they feel guilty about coming
It's a
for the
pretty good side
surgery
effect.
because they feel that's vanity.
Yes.
It's nothing to do with that. It's restoring their sight. And when somebody has, say, a droopy eyelid and it's very subtle, it's covering some of their pupil. And I have spoken to patients with, it's called ptosis, low, and their muscle slips from rubbing their eyes and everything, and it slips up, and I go in, stick it back on. This is interesting, speaking to a Norwegian about this, because my dear friend, Dr. Trina Jacobson, when I go to stay with them, Trina's a very highly educated physician, as you're aware, always at the cutting edge. And so they would have an ultraviolet light playing on their table, their breakfast table in the morning in Oslo, because you've such a low day in the winter, such a short day.
Yes.
So they have the UV light lamp playing.
Oh.
And I've shared with and we know it improves melatonin, circadian rhythm and everything. But I have these patients coming into me with half the light reaching their retina because their lids are all occluded. And the impact that might have on their mood and everything, nobody's even begun to look at.
If you focus on doing stuff you enjoy and stuff you love, as you say, it's not hard work, but then you're also going to be good at it. And if you're good at it, somebody's going to need you to do it, and somebody's going to pay for it. You're lucky enough to start, like I am, to do what you love to do. But you still need to sort of sometimes do something else.
Yes.
So outside work. So there's, what do you do? What do you do? You talk about meditation. You talked about...
No, well, I only learned to meditate years ago. I got sick and then miraculously I got better. But I didn't get better passively. I looked into it all. I play bridge. That's my new hobby.
Good. Yes.
Loving learning it. They say it takes you 4 years to learn it and the rest of your life to learn it. So I'm learning that. We started that during lockdown, a bunch of friends.
Oh, yeah.
I played golf love golf, played hockey in college with great fun. We won we got to the semis of the intervarsities, and there were only 16 in our hockey club when we were in college.
I remember that.
No, it was huge, but we had a wonderful player called Eleanor McNamara on the team who was on the Irish team. So nobody in Trinity, none of them could believe we beat everybody else. We beat Trinity. So, you know, I play a lot of golf now. I would have played a lot of tennis. Music, I'm in the Irish Doctors Choir. We have great fun. If anybody watching this wants to join, we perform twice a year. We would do some charity performances. It's run by a lot of colleagues in Belfast, but our director is Brian Kay. He lives in Portugal. He used to direct the Irish Chamber. And the music goes up on the internet. We're going to Salamanca Cathedral in November. So we'll go off together for 3 or 4 days, maybe twice a year, have great fun. And so that's great. I don't, what did you ask me?
That's a lot.
I do everything.
That's a lot what you do, I
have a lot of fun.
Yeah, but you also touched on meditation. I was interested in the meditation thing because we actually did some research on meditation in pilots.
Sure.
In military pilots. We did controlled studies on meditation and similar kind of things that were not meditation as a control group, and to look at the results. And we were doing all kinds of psychological tests and so on. But what we found was as a stress reduction, it's very effective, as you just said. You know, so science really supports the ancient kind of. But what we did was to try and make the pill, as it were, the meditation amount as little as possible if they're going to do it during their working day. So we got fighter pilots and helicopter pilots to do meditation during their working day. as a part of a,
Extraordinary.
they reported, those who continued, which were most of them, they reported that they improved their performance. They got better at focusing when they needed to focus. I was never good at, I tried golf, but I haven't really.
But you don't have to be
got
good at
into
it, you see. You just don't have to be good at it.
Yeah, I've been more like I've been a sailor, but a golfer.
Sailing.
Yes.
So I sailed as well. I sailed a squib. I love sailing. Please tell me, what do you sail? Tell me about your sailing.
I have a sailing boat, and the
Okay.
last 4 years I've been sailing part time, of course. During the summers, I've been sailing down to the Mediterranean.
Oh, wonderful.
Sailing around the Mediterranean. So now I'm sort of with different friends on board.
I'm booking in with you for a holiday,
Of course,
all right?
yeah. As a Norwegian, of course, culturally we all ski. So in the winter I go, it's cross country skiing.
It's another holiday I'll book with you.
Yeah,
Anthony.
yeah, and it's the same. I mean,
Yes.
you get in the flow, and
Yes.
and you're getting this closeness to nature and closeness to sort of, and you're doing something. So that's also, even though you're not, I've tried to meditate, I can't for some reason, but I find that I think I find the same kind of thing when I do those.
No, you do,
those
because
kind
I
of
watched
activities.
you take that deep breath you were unaware.
Yes, yes.
It's the same thing. There is no difference. That's it. It's just, that quietness. And it is so important for our health. And a lot of disease is sympathetic overdrive.
Mm-hmm.
The blood vessels are constricted, the blood pressure goes up, it grows tumours. So we can, in Ireland, with such a high incidence, I had tumours in the past, and you can take all the weed killer to kill off the tumours. But the important thing is fertilising the soil. Like Trina Jacobson's an expert in this, how one eats so that the soil is neutral and can't support the growth of tumours, how one alkalises with delicious food and everything, but also turning on the parasympathetic, which Sean's an expert in too, Sean Matthews, and why Ayurvedic medicine has always been so successful in certain spaces. And there's such a lower incidence of disease and tumours and disease and cancer. So I don't imagine in the future there will be medical schools without a retinal photo the day one goes in. In fact, they'll have it for biology in first year, age 12. They'll have retinal photographs now because it's so easy to take them. And looking at the anatomy on those, learning their biology.
Yes.
And I do think every school, it'll be an important part, learning that meditative space, because how can we share this health with our patients who we want to heal if we're not doing it ourselves?
Yeah, yes.
And that also includes dietary nutritional awareness, knowing how not to increase blood sugar, which I'm passionate about because I worked as a consultant in the diabetic retina screen program headed by Professor David Keegan in Ireland and Professor Louise O'Toole. And I would see the patients referred in Ireland with signs of diabetic retinopathy, the number one most common cause of preventable blindness in the world. Like 450 million people have now diabetes, and it's growing. So it's because they're eating, a lot of people, genetically you can get it, that's difficult. But people did not know that they're eating so much sugar would actually have this effect. I am passionate about the fact they're high risk of blindness. And that's why I feel a lot, people are, like Professor Donal O'Shea, a colleague who runs the obesity clinics, is fantastic, but it's difficult to share this with people because they feel you're talking about their weight and their appearance, and I couldn't care less about that. Nobody cares because it's this beauty in the body. I'm passionate about the sight. And if they are overweight, they're far more likely to develop diabetes down the road. And they're producing children who are eating food who will have a much harder time actually not being glucose overloaded. And new research was published last week in ophthalmology showing they were shocked to find out that glaucoma, the most common cause of irreversible blindness, is directly related to blood sugar. And they never knew that. And these are non-diabetics. So I feel this is going to be part of every medical school curriculum down the road. We just didn't have the research before. And I think the cross-fertilisation we get in the College of Surgeons, you a world expert in aviation medicine, because Norway, you have the army. We don't have the same thing in Ireland. Sean Matthews, an expert in Ayurvedic medicine and healing and everything for other reasons. This only happens in a college like this.
Oh, yes, I think so.
And solutions are produced.
Yes.
Professor Kieran Murphy with his interventional radiology.
Yeah, it's fantastic to get back and talk to everybody,
Yeah.
um, uh, and it brings back so many memories from the actual
Mm.
the college itself, being an
Mm.
alumni like this, but also seeing what people have done, which is so much, and it's
Mm.
such broad fields and so many excellent, fantastic people. So
Well, it is extraordinary. You've also reminded me that our education system, um, the way we had to learn, for example, in Ireland, in ophthalmology, we would all have to learn to give glasses refract. They don't do that in England or anywhere else. But Camilla said yesterday, we are one of the few colleges out of 500, top 500 university medical schools in the world that has cadavers for dissection, which is a huge part as a surgeon, the three-dimensional experience. You can do so much with AR, VR. But Fiona Doherty, a classmate of ours, she did renal medicine and everything and became a member of the Royal College of Physicians before she followed her vocation into psychiatry. And her expertise in America is picking up people in psychiatric hospitals who, like one woman she told me about, she became psychotic because of the steroids she was on for a condition. When Fiona met this lady and diagnosed her steroid-induced psychosis, this woman had been in a psychiatric hospital for a few years. She was immediately treated and back to normal because of the educational crossover, cross-fertilization. Very few of the American psychiatrists were trained at the physician level to come in and spot that crossover.
mm,
Isn't that exciting?
very interesting. It shows
Yeah.
that interdisciplinarity, which I
Yes,
think
that's the word,
is great.
Anthony.
And I've been working with a professor in Norway, who's a professor of medical anthropology,
Yes. Oh,
and she uses the word radical interdisciplinarity, which
wow.
means that not only do you talk to people who have other disciplines, but
Yes.
you also are willing to ask them questions and go into their field and challenge them in a way that
Amazing.
you become like you blend in a way the field. So I think
I've never
that's,
heard of that.
it's
And that's exactly
it's a
what we're
great term,
doing.
isn't it? Yeah,
But
radical
that's extraordinary.
interdisciplinarity. Yeah. I think we had to wrap up. I mean, it's been lovely talking to you, and I think that, and it's been fantastic being at
Mm.
at this college for this alumni. And it's amazing that the college is organising this in such a way. So I'm
We're
very
very
thankful.
lucky. We've got
We're really
classmates like
lucky.
Paul O'Reilly who keeps writing us the funny
Yeah.
emails and keeping everything together. And we're just very privileged. And may I say,
Yes.
I'm extremely proud that the Vice Chancellor of the College of Surgeons and the leader for a long, long time has been our
Oh
classmate
yeah. Yeah.
who got the medals all the way through college, was a brilliant surgeon, and Cathal Kelly, Professor Cathal Kelly.
Yes.
So we're very proud of that, aren't we?
So we're
You said it. Yeah.
star class.
I know you're blushing, Cathal, but anyway, we are the best year. We know it. We know it.
Absolutely. Yeah.
Yeah.
Thank you.
Thank you, Anthony.